I experienced pregnancy when my mom was pregnant with my siblings, and actually when I was in high school she ended up having a stillbirth, and I was with her when she was in the ultrasound room when they couldn't find the heartbeat. And that was really hard, and it really opened up my eyes to that experience and how important it is to be with somebody in that experience. And really it was the nurses who worked with her one-on-one, worked with her through bereavement, really listened to her. And it was at that point in time I knew I wanted to go into this field. I just didn't know what it looked like. So I initially studied actually environmental biology, and then eventually discovered midwifery halfway through my program, and just really appreciated that whole person model of care where you just get to be with people, you share decision making. Favorite part is working one-on-one with people and just being in visits and getting to be with people during this really vulnerable and special time in their life is the best part. And also that continuity of care that you get when you get to work with people when they're pregnant. You see them throughout their pregnancy, and then you get to see them postpartum, and just watching that change is really the best part. Like, I'm not just looking at somebody for their vital signs or their baby's heart rate when they come in. I'm thinking about everything that makes this person a person. So their family who's with them, and thinking about how their family is also going through the same experience and how they're supporting them. I also focus on those social determinants of health, especially here, because we all know that that impacts health and the health of moms and babies more than them just showing up for their visits. You have to go into it because you have a passion for wanting to make things better and make things different. And I moved back to India, like I left Indiana and moved back because I'm from here, and I really wanted to improve the health of like mothers and babies here. All nurses spend the most time with the patients one-on-one, especially in a labor and delivery setting. I mean, the nurses are doing it all. So I feel very passionate about making sure that we're teaching evidence-based practice. I'm really passionate about teaching my students how to stay up to date on research, and also how to just take care of people and realize, like, when you're taking care of people, it is more than just a job. You're meeting people, especially like in a labor setting, on this day that they're going to remember for the rest of their lives. So in Indiana, midwives who work in a hospital setting have to be trained as nurses and then go on to get further graduate education to become a midwife.